Upon entering the patient's room, introduce yourself and identify that you have the correct patient. Explain the procedure and answer any questions that the patient may have. Make sure you explain to your patient how you're going to maintain their dignity throughout the procedure, and that you'll be asking them to lie in a reclined position if comfortable for up to 30 minutes. Once your patient is comfortable, gain consent for the procedure to take place and for the patient to be laid down and rest them into a comfortable position. Wearing non-sterile gloves, swab the junction between the catheter and the catheter bag and gently remove the bag. Place a spigot into the catheter and this will stay in place for 30 minutes. Clean your trolley prior to setting up for your procedure. To prepare your procedure trolley, you'll need to gather all the equipment you require. For this procedure, you require a urinary catheter insertion pack, sterile lignocaine gel 2% with a syringe with an introducer, an appropriate sized urinary catheter, sterile water for injection sufficient to inflate your balloon, 2 10ml syringes, and 2 pairs of sterile gloves and your cleansing solution. Using an aseptic no-touch technique, open your catheter pack and insert the cleansing solution into the galley pot. Proceed to open the rest of your items onto your sterile field, taking care not to touch them. And carefully open and place your urinary catheter on the sterile field, leaving the inner packaging intact. Insert the sterile water into the syringe to the 10ml level as required by your catheter and place that beside your sterile field. When deflating the balloon of a catheter, best practice guidelines indicate that we should use a process of passive deflation. The reason of this is because silicone naturally wants to collapse on itself and can create a ridge which on removal can cause trauma to your patient and discomfort. It can take up to 2 to 3 minutes for a balloon to passively deflate. If you insert your syringe and you notice that your balloon is not deflating at all, you can try reseating your syringe, and if that doesn't work, you can try repositioning your patient. Keep in mind that once you've deflated your balloon, your catheter can be quite unstable sitting inside your patient, and you need to be careful not to pull on it. Using a sterile gauze or drape, grip the catheter at the skin level with your non-dominant hand and gently rotate it before sliding it out. Place it onto your sterile field, noting the position your fingers were at so that you'll be able to measure your new catheter against it and place a piece of gauze over the patient. Place your sterile drape over the insertion site. Remove the gauze from the patient. Give the area a gentle clean and remove your first gloves. Lubricate the end of your catheter and insert the lubricating gel into the patient's stoma. It's important to ensure that you're approximating the measurement against your old catheter of the insertion ready for the new one. To do this, you're going to slide your plastic down to the level of insertion, or you'll place your non-dominant hand at the level. Gently insert the catheter up to the level that you've chosen, and then slowly remove the plastic, ensuring that you have some urine flow. If you're happy that your catheter is placed correctly, inflate your balloon, gently watching your patient for any signs of discomfort. Gently pull on your catheter to ensure that your balloon is inflated correctly and that your catheter is secure, and attach your new bag. Perform hand hygiene and pack away all of your equipment. Document in the patient's chart and check in on your patient to ensure that the catheter is draining freely throughout the shift.